Knowledge is something that is meant to be shared, isn't it? This is something that I have learned through my experience, my hands-on, my practice during my casualty days. So after referring quite a lot of books, I did get a lot of information, something that could be shared with you online, and this could be even used as a reference for me as well. So as you can see, there are so many domains under this. I have learned a lot. I've seen like about 40 different types of cases during all my 2-week posting, and so I think this video might get quite lengthy, so I thought why not make it into a series and then split each and every part into a separate video, so that it could just be like 3 to 4 minute video, and something that could be interactable, and it could be reachable to you as well. So let's get into it. And for those of you who do not know me, I'm Dr. Divya Sai, and here on this channel we'll be talking mostly about the medical videos. Apart from that, skincare regime, fitness regime, I know I have to upload a lot of them yet, but then mostly under the medical domain. So please, what are the things that you'll be getting at the end of this video, or end of the series as I say? Okay, we have about the burns, and then poisonings, a lot of poisonings, and then trauma cases, acute lung and abdominal conditions, and then you have metabolic abnormalities, and coming to the last, that is the miscellaneous topics, where I would be talking to you about the different types of catheters, and then the color coding systems, the triad system, and then how to write a medical legal case sheet, and a lot of drugs. I say a lot of drugs. We'll be just going through all of them. So stay tuned. Coming to the first part of the discussion, that is burns. We have electrical burns, fire burns, and chemical burns. So firstly, coming to fire burns, which are the most common, we get cases which are mostly of suicidal ideation, and the second thing is accidental burn, that is a gas tub injury. Okay, coming to first burns, you have to assess the extent of burns using Wallace rule of 9. Okay, it varies for both adult and pediatric. If the person is greater than the age of 13, consider him to be an adult population, and then calculate according to that. So it is always advisable, whenever you get the case sheet, you need to mention it in the form of in order to assess the degree of burns, you have to mention it in the form of the front part and the back part. Say, suppose if the hand is fully burnt on both the anterior and posterior aspect, you have to just mention it in the form of 9%. You know, if the front part of the chest is involved, just write it as a 9%. If the back part of the chest is involved, write it as a 9% here. So that is how you mention. In case the lower back is burnt, just mention it as 9%, for genitals as 1%, and then assess according to the rule of Wallace chart, and then you need to make a small diagram of it and write the percentage of burns on each and every area. Okay, apart from that, the basic line of management is you need to first check the vitals, and then go for IV cath placement, and always go for a bigger bore, say a green cath, because the first and most important thing in a burns patient is what is called as hypotension, or which is due to a hypovolemia. Okay, so how does this happen? See, whenever the skin is burnt, the greater body surface area is lost, and there will be an increased vascular permeability, where a lot of vasoactive peptides are released, and because of which there's a lot of fluid loss from the body. As a result of which there's a decreased cardiac output, decreased renal output, leading to renal failure, and then cardiac failure. So the most important thing here is hypovolemia. Got it? So this is a major issue whenever you encounter a patient with burns. So how do you correct it? Renal lactate is fluid of choice. For at least the first 24 hours, a renal lactate supplementation is a very good idea, and for that we follow a Parkland regimen. That is a little next step of management, but the basic management is immediately place an IV cannula, preferably a green bore cannula, and then start on renal lactate. Apart from that, what you can do is place a Foley's catheter. Always remember to place a Foley's catheter for a burns patient, because you need to calculate the input-output chart. That is called the IO charting. Okay, you need to calculate the urine output of the patient. This is very important for a burns patient. Whenever the percentage of burns exceed 20%, we need to always perform a venesection procedure, which is usually done by the surgeons. So keep in mind. Okay, what is this venesection procedure? It is something that which would help to balance the body fluid levels, which will help in or in case of any circulatory shock. A venesection is always helpful because you'll not be able to trace out the vessels so easily, and a venesection is something that will come in hand. So beforehand, always perform a venesection. And how do you do is that on the medial surface of the foot you have the greater saphenous vein crossing over the medial malleolus, and you always need a butterfly cath for this. Try to get a butterfly cannula, and then it's just finding out the greater saphenous vein, inserting the butterfly cannula, and then secure it. And you could actually connect the RL directly to the butterfly cannula so that this greater saphenous vein will serve all the purpose that you needed in case of any emergency further. Apart from that, you need to always give TT and anti-tetanus immunoglobulin. That is something very important, and I personally myself never gave unless until I read in the book. So it is very important because we usually are advised to give a TT in case of a trauma patient. But then, don't you think that burns is a trauma? Because most of the body surface area, that is the first line of your barrier, is lost. So it is very, very important that you give a TT and an anti-tetanus globulin, ATG, 500 units IM. So that is another step of management that is quite important. And after that, you can do a symptomatic management where you actually dab, give the person a normal saline bottle and then ask him to dab over the affected area. And another life-threatening issue is any affection to the airway, burns involving the airway. Suppose if the person is in a closed room, make sure that you get the exact details of how the incident has occurred. Because if the person is in a closed room, there might be chances of carbon monoxide inhalation, a lot of it, which can lead to laryngeal edema and an airway compromise. So that is very important. So whenever the burns are involving the head and neck area, it is very important that you get an alert to the surgeon. You have to alert the surgeon saying that this is a high risk case and you have to follow the protocol as quickly as possible. And because the major cause of death might be hypertension, which is due to the loss of body volume, and the next thing is sepsis, is an important case. Okay, that is all you need to learn about fire burns. And coming to electrical burns, we might think that electrical might not be that dangerous, but indeed electrical burns are quite dangerous. I will tell you why it is dangerous. Because electric burns, they are mostly due to shock burns, where a person usually catches a transformer, or indeed the transformer might actually attract the person. I don't know what to say. Okay, but yeah, I have seen many cases where people come with electric burns and you see this characteristic crocodile type of pattern on the skin. It's kind of something like this, it's like a crocodile skin burn. Okay. That is how patient presents typically with, okay, and the patient might seem to be normal, but then you need to follow the same protocol as you followed for a fire burns, okay. You need to assess everything, do the same initial step of management as for a fire burn. But then mind you, whenever a person comes to you with an electrical burn, you need to always, there are high chances of major internal organ injuries. So you need to, first thing you need to do is perform an ECG, okay. Check if there are any ventricular arrhythmias, and because the major cause of death for an electrical burn patient is ventricular fibrillation. Second thing, there might be GI damages and chest damages. So after doing an ECG, perform an ultrasound or a chest X-ray or CT, whatever is needed in case, and then that is very important for an electrical burn patient. So what is the take-home message for a burns case? In case of it, if the person is coming to you with a fire burns, always remember vitals first. Second, always place ringer lactate. That is very important. Fluid management. And then third thing is keep a Foley's. And fourth thing is venesection procedure. That is important. Coming to fire, and fifth one I forgot, TT and ATG. Both are important. Coming to electrical burns patient, I forgot to mention this point where bone injuries are very common for an electrical burns patient, especially posterior shoulder dislocation is one of the most common things. So always try to rule that out. And then ECG, ultrasound is very important apart from the basic management of the fire burns. Same for the electrical. Apart from that, ECG and USG is very important for an electrical. The next thing we'll be talking is about poisons, which is a major chapter, and then let's go in detail about each and every poison and then all of its management. So this is all about this video. Just let me know in the comment section below if I missed something or if there's any controversy. Just let me know in the comment section below. Thank you so much for watching. Please support this. Thank you.